Hey, Dr. C here with you. So how do you increase your own thyroid hormones naturally? This is a really important question. No one wants to need long-lasting treatment. We want our bodies to work all right. We want them to take care of themselves and not be dependent on medication. The recalls are frustrating, always going back and checking and rechecking and adjusting. You just as well not have to do it. I completely agree with that. So the first question is, well, why is there too little to begin with? And let me just briefly talk about the main mechanisms of autoimmune thyroid disease. So what we now know is that the thyroid can have damage to its cells, it can be slowed down, and the immune system can go after the thyroid proteins. And the main things behind this relate to a little bit too much iodine in those who cannot tolerate it. The basic idea is that iodine it's like bleach. It's like a really strong antiseptic, and that's why you put it on your skin to kill bacteria. Well, in the body, it's a pretty dangerous chemical as well, and we need some. It's important to the right amount, but some people cannot tolerate a little bit extra. So the extra iodine, it gets stuck in the wrong parts of thyroglobulin, the protein that makes thyroid hormones. And the extra amounts release free radicals, they damage the adjoining cells, they pull in the immune system. And then the immune system starts to attack thyroglobulin, antithyroid peroxidase, and iodine directly slows the thyroid. So that's the big cluster. So who has a chance of making more? Well, here's an exciting thing. We now know that the idea of thyroid disease being something that goes on by itself, it's probably not true. We now know that the biggest driver of starting it is extra iodine, and that's perpetuated by even just normal amounts of iodine. It doesn't take a whopping amount of iodine every day. It takes a little more than you can tolerate at one point, and then even just normal amounts can be too much for the gland to get rid of the excess. It can hold on to that excess for just long term. But it doesn't mean the gland is permanently damaged. It means that that situation has not been rectified. So less iodine can rectify that for a good percent of people. So who can likely make more? Well, who cannot? So those that don't have a thyroid gland cannot likely make more. And I've seen an exception to that. There's so few times you can almost never make absolute statements. I would have made that as an absolute statement, but a year or so ago, we had a patient who had a thyroidectomy, allegedly, and yet as she followed protocols, she regained her thyroid function back again. So in retrospect, it was not a complete thyroidectomy. There were some tissues left behind, but that's not typical. So by and large, if your thyroid is taken out, you'll need thyroid meds long term. Having said that, there still can be a lot of steps you can take that help you feel better. And the iodine regulation can still be one of those because it changes how your body responds to thyroid hormones, not just how you make them, but how you respond to them. So it's still useful. Now, others who have had part of the thyroid removed, that can also cut their odds of making more. And then there are those who, at time of diagnosis, have the most marked deficit of thyroid output. So that is a combination of a very high TSH, often well above 12, and low levels, below range levels of T4. So in that pattern, it's less common to see your own function come back. In more typical scenarios, the TSH is above ideal, or it's a little above range, but the T4 has not plummeted. It's not gone way below range. And in those cases, there's a really good chance of thyroid function coming back again. So how do you know how much you're making right now? I'll get a link to a thyroid calculator. You can get exact amounts on that. But as a generalization, every 100 pounds of body weight would equal about 1 grain of natural desiccated thyroid, or about 100 micrograms of T4. So if you're a easy math, 150-pound woman, and you take a 150 microgram dose of T4, or a 1.5 grain dose of nature thyroid, and your scores say that you're perfect, you're probably not making much by yourself. On the other hand, if you were, make the math easy, a 200-pound person, and you were taking 100 micrograms of T4 and your levels were stable, well, you're making about half of that because the medication is about half of what you need. So you're making the rest. So that's a general way you can get a sense on how much you are producing at a given point in time. So what has been proven to cause your body to make more thyroid hormones naturally? Well, there's basically three things, and I'll talk about all those in a little detail. So the first is the thyroid reset diet. This is by far the most prominent. We've got multiple controlled human studies in which people with severe thyroid disease were found to have their own thyroid hormones come back online again. And I'm just so excited about that, and that's why I'm so jazzed to talk about the book. So yeah, in the course of, per the studies, either 8 weeks or 12 weeks, somewhere between 60 to 80% of people regain normal thyroid function just by lowering their iodine. And those are the numbers that got all the way normal, but if you also add in those who improved a lot, that ends up being 90, 97% of people from the studies. So the odds of improving are almost definite. They were very common. So that's to date the only thing shown to reverse thyroid disease that consistently. So two other factors have been shown to improve thyroid function, one of which is weight loss. And this is fascinating. So we know that thyroid disease can cause weight gain, but it's a two-way street. We know that weight gain can also cause thyroid disease. So there can be a vicious cycle for some to where the extra weight makes it worse and makes the thyroid function worse, and the thyroid function makes the weight gain easier. So yeah, those who are able to lose weight often notice that their thyroid function improves just from that. And that's why with the metabolism reset diet, I encourage people to monitor their thyroid function. They may need less medication. And I talked before about how you can predict your medication needs based upon pounds of body weight, but the changes of thyroid function that occur with weight loss are usually much more than that. If it were just a matter of having less weight, then sure, if you drop, just a silly example, if you went from 300 pounds to 100 pounds, your body would need a third as much thyroid hormone because of that. But no, the changes are much greater than that. As a generalization, it's the first 5-10 pounds that one can lose that has the biggest effect upon lowering inflammation and improving the efficiency of one's chemistry. So yeah, even just reasonable amounts of weight loss can have a big improvement upon how much thyroid hormone you make. Now the last thing, this is kind of funny, but this is a process called Dprescribing, which just means going off thyroid medication. Now I'll talk about this in detail on another post, and when that's up, we'll link to that. But in the meantime, it's something that I don't recommend just jumping into, but there have been multiple studies in which people were, in a controlled fashion, withdrawn from their thyroid medications and watched to see if they could make more by themselves. And somewhere around 30-40% of people, and this is not if they lose weight, this is not if they regulate iodine, this is just taking less medicine. So yeah, about a third of people, if they take less, they do fine. They don't really need any if they do it well. So again, those who have no thyroid or those who had the most marked hypothyroidism going into it, it won't apply to those without a thyroid, and it rarely applies to those that have low T4 when they're diagnosed, way below range. But others, many can safely decrease and do well. So those are three things shown to help you make more thyroid hormone. Now there's a couple of things that can often help and likely will contribute in a positive way, and I'll talk about those too. So first one is cortisol regulation. This is about your morning cortisol spike to your nighttime cortisol drop. You should have a good cortisol slope. If you don't, that can make your body more thyroid resistant. So yeah, please be aware of that. And you can suspect that if you commonly have negative changes to symptoms at certain times of day. You always crash in the afternoon, or you always wake up at 3 in the morning with your mind racing. Those are times we think about someone having a poor cortisol slope. And the adrenal reset diet and all the information around that, that's the simplest solution for it. Other factors would be resolving nutrient deficiencies. A couple that can affect most people can be selenium and zinc, and I do encourage good thyroid-specific multivitamins to help to offset that. There are those who are below optimal in iron. Not everyone, but for those who need it, it's a big deal. So good to be aware of that as well. Then we think about detox. There are those who carry mercury or lead in their bodies. And these are a couple of many toxins that can make your body have a harder time regulating and using thyroid hormones. And they may also worsen the inflammation that's behind thyroid disease. So if you're taking steps to help your thyroid work better, how do you know if it's working? Well, the most clear first thing to change would be TSH scores. So a TSH score moving downward means that there's more thyroid hormone coming in. And assuming you're on thyroid medication, and assuming you didn't just change the dose, a lowering TSH means you're making more. Now, assuming your testing is accurate, and assuming that you're getting good data, and your medication is consistent, that means you're making more by yourself. You know, a quick tip, I encourage people not to put a whole lot of weight in a single TSH reading. So if you're plugging along and suddenly your TSH is a lot lower, it may be a fluke. There's many times where one reading is just a fluke. And sometimes there's predictable reasons for that, sometimes there's not. But if you're seeing a clear trend, so it's a lot lower and you feel like you're getting too much, you know, your heart is racing and it's continually getting lower, yeah, that means there's more coming in from somewhere, and that's a good sign. So the trick with that is you want to work with your doctor to adjust the dosage to allow the TSH to stay in a good range. If it goes too low and stays there, well, that's a risk by itself, but also that makes it to where your thyroid can't heal. The TSH tells your thyroid to grow, to get new cells, and if there's no TSH there or very little, it will not grow. So even if it could, it would not. Now, the other thing to think about are thyroid antibodies. So they might reduce by these various steps. That's an encouraging sign, but it's not a sign that there's more hormone coming in. It's a sign that there may be less attack on the thyroid. And that could precede the TSH getting lower, but it's not the same thing. And it's not as strong of a win. So it's a good sign, but it doesn't mean that you're definitely making more. It means that you might make more if that does continue. So yeah, that's the main point. If you see those changes with medication, it's appropriate to adjust that gently with your doctor so you're always in a range encouraging your thyroid, but not overtaxing it. But this is possible stuff. Many can notice their function get better, especially with the data behind the thyroid reset diet, and that's an awesome thing. So Dr. C here with you. I'll see you again really soon. Bye-bye.